University Sarjana Putra. I'm Nadia Kamal from the Faculty of Health Sciences, MAHSA University, and I will be moderating the session today. Today's webinar is hosted by the Faculty of Health Sciences, MAHSA University, and the title of today's webinar is Preparing for a Mammography. Dear viewers, before we proceed further, I would like to give you a brief overview of the programs offered by the Faculty of Health Sciences at MAHSA University. So under the Faculty of Sciences, we have School of Physiotherapy, Department of Environmental Health, as well as our Department of Medical Imaging. So under the School of Physiotherapy, we have 4 programs: Bachelor of Physiotherapy, Diploma of Physiotherapy, Bachelor of Physiotherapy ODL, and Master of Physiotherapy. Under the Department of Environmental Health, we have Diploma in Environmental Health, Diploma in Occupational Safety and Health, Bachelor of Environmental Health and Safety, as well as Bachelor of Environmental Health and Safety by open and distance learning. For the Department of Medical Imaging, I would like to share some slides on the programs that we offer. Okay, give me 1 second. Okay, under the Department of Medical Imaging Faculty of Health Sciences, MAHSA University. So as you can see now, this is the pictures of during the installation of our new machines early this year. So you can see my pictures everywhere. Sorry for that. And then the area of specialization for medical imaging field, later after you have completed Bachelor of Medical Imaging, you might go for specialization. You can choose what are the modalities that you like to further on. So these are some of the specialization that you can further later after you have completed your bachelor's. Okay, so why you should choose MAHSA University? So basically, our programs are fully accredited. We have experienced lecturers and staff, and medical imaging is basically a sector in demand where we have our graduates who just graduated getting the jobs recently. We send our students for clinical placement in various centers and private hospitals. We also have facilities. Later on, when we have our own hospital, we are looking at more modalities to offer to our students for clinical placements. Okay, so why medical imaging? So we are dealing with high technology, and as along with dealing with technology, we also serve the patient. So you have a balance there where you operate the machine, operate the modalities. At the same time, you still have the value of humanistic, where you communicate with the patient, you serve the patient, you deal with them every day. After that, if you feel like going abroad and work abroad, we also have our alumni who are working overseas. And this field is basically a highly skilled employee. You can be trained as highly skilled employees, and you have opportunities to go and further abroad or locally based on what modalities that you like. It is a very challenging and exciting field actually. Okay, so the student experience, once you choose MAHSA, we offer you wide range of clinical facilities. There are also conferences, webinar that we organized. Recently, we just organized an international conference. Along with that, we have mentor, mentee, and buddies program. And there is also scholarship and financial assistance available. Okay, let's talk about the programs. Okay, the first program is Bachelor of Medical Imaging, where the program is 4 years program for direct entry students. Direct entry means you enter from matriculation or STPM, or if you are having a diploma, so you can shorten your period of study to 3 years because you get the credit transfer. but the credit transfer is based on what you have studied. We have to map that first. Okay, these are the list of courses that you will learn in year 1, year 2, year 3, and year 4. If you look at the the program structures, we have clinical placement up to 7 clinical placement 7. That means you are going to be sent to hospital for clinical for 7 times. Okay, a little bit on the entry requirement. For those who pass matriculation pre-U STPM, you need to have at least minimum GPA of 2.33 and 2.33 in 2 of the following subjects: biology, physics, or math, or chemistry. For those who has finished your A level, we need minimum D in the same subjects: biology, physics, or math, and chemistry. And then for those who have finished your diploma, you can pursue Bachelor of Medical Imaging with minimum CGPA of 2.75. If you have less than that, but you have 3 years experience, you are welcome to join us. So the English proficiency for the local student is MUAT Band 3, and for international student is TOEFL 550 or IELTS 5.5. Okay, for ODL programs, it is a 4 years program. Again, for those who have finished your diploma, you can shorten to 3 years, depending on how much credit transfer you get. The list of subjects are the same, only the platform or the mode that we offer deliver is different, where open and distance learning means you study from distance and it is done on an online platform. Okay, so entry requirements are much the same with the Bachelor of Medical Imaging conventional mode. And okay, for these are our ex-students. So if you can see here, we have this student just recently graduated in early 2021. We have Mr. Dina here, who is now working in the Monday Maternity Center. He is a local student. So Mr. Ilu is pursuing study to the master level in UK, United Kingdom. And then Mr. Muhammad here is working in Shafi Hospital, Mogadishu, Somalia. And then Mr. Barakon here is working as radiographer in Nivamin 9, Bangkok, Thailand. Okay, these are the facilities that we have here in MAHSA, Bandar Sarjana Putra. And the collaboration, we did some collaboration with Malaysian Society of Radiographers before, where we organized a conference with them. And these are the frequently asked questions. Sometimes people do not really familiarize with the term radiographer. So radiographer actually works in the hospital or medical center, or they can also work in multinational companies. So if you want to change your career to work with multinational companies like Siemens, Philips, you can do so. Some of the radiographers pursue study to a high level and become educators in educational institutions. All right. Another frequently asked question, whether it is easy to get jobs. So I have already explained that our recently graduated students have all, most of them are all working. And is there any opportunities for you to work, to go for higher or specialized study? Yes, we have local and overseas institution who offers programs. For in local institution, we have UKM, UITM, IIUM. Overseas, you can always pursue your study in UK, Australia, as well in the Queensland. And then other than that, you can also go for specialized training, like in Institute Jantung Negara, IJN, and you can also specialize in ultrasound, MRI, and nuclear medicine. So range of salary are between this figure, but that also differs on based on the organization and hospital that you get the offer. Okay, role of radiographer. Basically, we have a vital role in confirming any diagnosis. We take pictures, we take x-rays and images to confirm diagnosis, but the diagnosis is done by the radiologist. We assist in the decision regarding the treatment and future care. We provide patient care to the patients and also liaise with the members of the healthcare for better patient care to the patients. Okay, this is the career pathway from diploma. If you want to pursue diploma, so after you have graduated with diploma, you can work as radiographer. Also, you can also work as medical sales representative. After that, if you want to pursue your study to bachelor level, you can become a radiographer, also an application specialist, angiographer, clinical instructor, or sonographer. After that, if you want to pursue to a high degree to master level, you can become an academician or researcher. And if you want to pursue in medical field, you can also pursue to a PhD and devote yourself to academic field. All right, so these are the ways that we deliver the program. So there are nowadays, because of the pandemic, some of the studies are done via e-learning or online. We have also the conventional ways of doing things like lectures and tutorial. Practical and clinical practice, of course, we are going to send you to the hospitals, and some of the assignment, case study, as well as the presentations. Okay, this is our former students. Miss Aina Kamila is now working in Qatar. She is also pursuing study with us now. And another alumni who is Miss Marzia, working in Iran as MRI technologist. Okay, I think that's all for our department. So let's move on to our webinar today. All right. So please, for any inquiries, for more information on our programs, you can feel free to contact us through MAHSA website or our faculty Facebook page to know more about our programs. Or you can also simply leave a comment and we'll get back to you. Your question concerning this webinar session can be listed in the chat box or discussion during the Q&A session. And dear viewers, if an e-certificate will be provided for this webinar, and to be eligible for these certificates, please fill in the survey form, and the link to the survey will be provided at the end of the seminar, and it can be found in the comment section. Okay, let's talk about our webinar today. I'm sure all of you are waiting patiently for our speaker today. So let's talk about mammogram. Mammogram are the best tool for early detection of breast cancer. And women above 40 years old should get your mammograms every year, yes. And this webinar aims to focus on providing answers to some commonly asked questions and the do's and don'ts in preparing for mammography. Okay, let me introduce you to our speaker today, Miss Ainul Fadlin binti Othman. So Miss Ainul Fadlin holds a Master of Science in Radiation and Nuclear Safety, also Bachelor of Science in Diagnostic Imaging and Radiotherapy. Both are from University Kebangsaan Malaysia. Miss Ainul has previously served as a radiographer and a mammographer in a few private hospitals, and she has more than 5 years of academic experience in medical imaging. Okay, let's see, where is Miss Ainul? Hello, Assalamualaikum. How are you today? I think you are muted, Miss. Just wait for a second. Maybe the button is jammed. So I think you have to be more patient today. Not to worry, she'll be back. Hi,
Hi, sorry.
it's okay. That happens all the time. Okay,
Yeah,
so Miss Aino, how are you today? How are you feeling?
fine,
I'm sure
fine, thank you.
a lot of people are waiting for you. So hopefully we can have a insightful discussion, a brief information to be given to the people outside there so that they can decide to go for appointment for a mammography.
Yeah,
So,
sure, inshallah.
all right. So the screen is yours. You may get ready and share the screen.
Okay, I'm sharing my screen now. Thank you very much, Miss Nadia, for your kind introduction. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Ainu Fadlin binti Othman. Uh, I'm a lecturer from Medical Imaging Department, Faculty of Health Sciences, MAHSA University. So for today's webinar, I am going to conduct a sharing session on preparing yourself for mammography procedure, what to expect during a mammography examination, and also I'm going to share with all of you out there a few tips on the do's and don'ts to undergo mammography procedures. Okay. I believe all of you can see my screen, right? Does it appear on your uh, screen now?
You're not on your screen is not up yet, Miss Ainul.
Just wait for a while.
It's okay. Take your time.
I'm sharing my screen now, yeah? So sorry. Okay. All right. So for today's webinar, I'm going to conduct a sharing session about preparing yourself for a mammography procedure as well as tips on do's and don'ts to undergo mammography procedure. Okay. So for to start our session, first of all, I would like to give some introduction to the definition of what is mammography is all about. So mammography is a specialized medical imaging procedures that uses a low dose of X-ray system to visualize the inside of your breast tissue, whereas the mammograms refers to an X-ray image of the entire breast tissue. All right, the mammography procedure is going to be conducted by a trained mammographer who is knowledgeable and skillful in performing the mammography examination. The mammograms then would be viewed and diagnosed by the radiologist. Okay, radiologist is a medical doctor who is specialized in diagnosis and treatment of pathologies using medical imaging procedures. So as shown in this picture, the radiologist is viewing the mammograms to find the diagnosis and any pathologies regarding the breast tissue appearance. Okay, so in this picture, I'm showing all of you how the mammographer, very sweet mammographer, is ready to position her patient. Okay, here the patient standing readily for the mammography procedure. The mammographer will be able to manipulate the mammography machine in order to produce high quality image of the breast tissue. Okay, in this picture also, I would like to convey my courtesy to the picture to my former batchmate back in UKM during my undergrad study, who are now working as a mammographer in this picture. Thank you very much for the picture. Okay, so actually, uh, there must be a reason for having your mammogram done, right? So actually, there are two types of mammograms available to be performed based on its purpose. Okay, so first one is called as screening mammogram. Okay, a screening mammogram is done when you have no problems or concern about your breast. So this type of mammogram that is done during your annual checkup or biannual checkup. Okay, during a screening mammogram, it can detect the presence of breast cancer in the situation that absence of any sign and symptoms. The second type of mammogram called the diagnostic mammogram. Okay, so diagnostic mammogram is done for a group of women for several reasons. Okay, firstly, to evaluate any area of your breast tissue that has a lump or any other sign or symptom that might indicate cancer or any other breast pathology. Okay, we call it as diagnostic mammogram. Second reason to perform your diagnostic mammogram is to further evaluate any suspicious area firstly seen on a screening mammogram. Okay. The third reason to perform a diagnostic mammogram is to re-evaluate an area that's been treated for cancer treatment, okay, such as after the surgery, after chemotherapy or radiotherapy, patient come to your unit, to mammography unit. So we as a mammographer, we perform diagnostic mammogram, okay, where we re-evaluate. We want to demonstrate the effectiveness of your treatment. Okay, so these are the reason for a second type of mammogram, which is the diagnostic mammogram. So, who are the candidates to undergo a mammography procedure? Okay, so in mammography clinical practices, we follow the guidelines to advise yourself or a group of women to go for their mammography examination. So generally, based on the general guideline, for when should you start getting your mammograms are based on these two types of condition. Okay, first one, for the woman of average risk of breast cancer. So this group of women can choose to start being screened by the mammography screening at the age of 40 years old, while the other guideline also advise this group of women to start breast screening using mammography at the age of 45 or 50 years old. The second group, okay, we call it a group of women with a high risk. If this group, if you have a family history of breast cancer or history of precancerous breast lesion, okay, so you would be included in this high risk group. Okay, so your physician or your doctor may recommend you to start getting your mammograms done before the age of 40 years old. Okay, sometimes in this group of women, a combination with other modalities still in medical imaging field, we call it as breast ultrasonography, may be recommended for you. Okay. So now I'm sharing with all of you out there, with all the viewers out there, a table of comparison between a few health organizations about the breast cancer screening guideline, a comparison between a few healthcare guidelines or recommendation. Okay, namely the American College of Radiology, ACR, and Society of Breast Imaging, SBI, compared to the American Cancer Society, ACS, the American Congress of Obstetrician and Gynecologists, ACOG, the American Medical Association, AMA, the National Comprehensive Cancer Network, and also US Preventive Service Task Force. Okay, they come up with this kind of guidelines, so all the women out there can refer to their recommendation on the age to start your mammography, the age to stop doing mammography, the interval between one mammography to another mammography examination, and also recommendation on additional view using this new technology in mammography, which called as tomosynthesis three-dimensional mammography. Okay, so as you can see, ACR, American College of Radiology, and SBI recommend you to start your first screening of using mammography at the age of 45, at the age of 40, sorry. And some other organization recommend to start at 45 and 50 years old. Okay. There are no age limit recommended by the ACR, and it based on the tailored to the individual health status. Okay, but some of them recommend you can stop doing mammography screening at the age of 75 years old. The interval, most of them recommend to the mammography to be done annually, or when you, at the age of 50, you can do the mammography every 1 or 2 years time. Okay. They recommend, the health organization recommend the woman to undergo tomosynthesis three-dimensional mammography in order to improve cancer detection using three-dimensional image. Okay, so dear viewers out there, so based on those guidelines, are you now included to be one of the suitable candidate to a mammography examination? Okay, if you are, so here I'm going to share some of the importance. Okay, why you need to know what to expect during the mammography examination. Okay, so actually, by knowing what to expect during a mammography examination, it actually may ease the procedure, the mammography procedure, for both of us. Okay, both parties, so, whether the patient, yourself, and also we as a mammographer. Okay, so by having you know what to expect during a mammography, it will help us to smooth to run the process, the mammography examination smoothly. Okay, you may also find it reduce your anxious, okay, your anxiety, your fear, okay, towards the procedure if you know what to expect during a mammography procedure. Okay, I still remember during my experience, one of my experience dealing with a patient when I was working as a mammographer before. Okay, I called this patient. Okay, I called her to the mammography room. She was barely moved. Okay, she even cannot make a step closer to our mammography machine. Okay, her body become stiff, become rigid, so she cannot move at all. Okay, in such cases, in such event, we as a mammographer, we cannot force you to be positioned for a mammography procedure. Okay, so last time we need to stop everything first. Okay, let the patient sit down and relax, then only we can resume to the mammography examination. So actually we as a mammographer, we really need your full cooperation from the patient, especially during the part positioning during the mammography procedure. Okay, so actually we need you to get your cooperation, to get you to move and to listen to our positioning instruction. So you need to be in a relaxed mode, okay, so that we can perform the procedure smoothly. All right. So we need to get your full cooperation in this case. Okay. Another reason for having you to know what to expect during a mammography procedure, most importantly, because we need to avoid, we have to avoid repetition. As mammography, we are dealing with X-ray, the ionizing radiation. Okay, we need to avoid repetition that cause higher radiation exposure to the patient. Okay, so when dealing with this ionizing radiation, this X-ray, there are no such thing as extra shot. Okay, make another shot, cannot. Okay, it does not work that way in terms of radiation exposure. Okay, all right. So in MAHSA University, we train our student. Okay, we train our medical imaging student to always adhere, okay, always comply and practice radiation protection principle, where we will always keep the radiation dose as low as reasonably achievable. We practice our student to deliver optimum radiation dose without exposing the patient to the unnecessary radiation. So by having you full cooperation from you as a patient, we can avoid a repetition and cause you higher doses of exposure. Okay. All right, so in this picture, okay, is how we as a mammographer need you to be positioned during a mammography technique or one of the mammography technique. Okay, to be able to do so, we as a mammographer, we need full cooperation from all of our patients. Okay, so during a mammography procedure, you will have to be undressed above the waist up for a mammography procedure. Okay, so we will then provide you with a special front opening gown to wear during the entire process. Okay, the mammographer then will position your breast on the mammography machine, or we call it as image receptor plate. Okay, we position your breast according to the specific mammography technique. You and the mammographer are the only ones in the room during the procedure. We will lock the door. Don't worry. All right. In order to get a high quality image of your breast tissue, we must compress your breast. Okay. So this is a must. Okay. This is a must to compress your breast. So it is the most the scariest part of mammography among the women out there. All right. By the way, we this is necessary to get the image of the breast, since the breast is a soft tissue structures. Okay, we need to compress the breast, bring it as close as our image receptor in order to get the higher quality of mammograms. Okay, so during the compression, the mammographer places your breast on the machine's plate, and then a plastic upper plate is then lowered down to compress your breast for a few seconds while the mammographer takes a picture. Okay, and then you will need to change your position to the next procedures or to the next image to be taken. Okay, this is how the compression pedal looks like. Okay, so this is the compression pedal. Okay, it will be lowered down onto your breast tissue. Okay, onto your breast tissue. Um, After the procedure, the compression pedal will be automatically released. Okay, it will automatically release after the exposure time. Basically, the whole mammography procedure takes about 20 minutes. Okay, but the actual breast compression only happen in a few seconds each time. Okay, you might feel some discomfort on your breast when your breasts are being compressed, and some of the women may find it painful as the pain tolerance are different individually. Okay, so basically two view or two images of each breast are taken for a screening mammogram. Okay, but for diagnostic purpose, okay, for diagnostic purpose, more images may be needed. For example, we have magnification view where we need to enlarge certain area of your breast tissue. Okay, let me show you how. In this figure is showing the A image is actually the standard image of your mammogram. Okay, and then the radiologist find it some suspicious area on this white arrow. Okay, a dark full lesion is seen on the standard mammogram. Then the radiologist may ask the radiographer to perform another mammography technique. We call it as magnification view using different compression plate or spot compression plate. Okay, where we need to use this technique to enlarge the suspicious section of your breast tissue. Okay, so in this B figure, spot compression with magnification view show normal findings. Okay, in this enlarged or zoom in image. Okay, so we go to the next part where now I'm sharing some of the do and don'ts tips with all of you out there so that you can walk through your mammography examination confidently. Okay, first of all, okay, do look for accredited diagnostic facility that offer mammography examination, all right? So in Malaysia, we practice based the quality assurance practices are based on the Malaysian Ministry of Health and also based on the requirement of quality assurance stated by the American College of Radiology (ACR). So this is to ensure that the standard and quality of the instrumentation, okay, our equipment, and also our personnel who conduct your mammography examination meet the standard and quality. Okay. The second one, do try to go to the same facility each time. Okay, why? Because this is to ensure your findings are easily compared. Okay, since it's annual interval, okay, so it can be easily compared from 1 year to another year of examination. Okay, do bring your previous mammograms if there is any for comparison purposes. Next step, okay, next step, do schedule the mammography appointment in any mammography facility when your breasts are less tender. Okay, since we need to compress your breast, so avoid to set the appointment the week before the menstrual period. So that you may reduce pain sensation and also discomfort during the procedure. Okay, so avoid the week before your menstrual period since your breast may feel tender during that period of time. Okay. Next one, do wear two pieces of clothes during the on the examination day. For example, try to wear a blouse with pants or blouse with skirt so that you might find it is easier to change into the hospital gown later. Do inform your mammographer if there is any changes or problems in your breast before they performing a mammography to you. Okay, inform any changes, any sign or symptoms such as a lump, a nipple discharge, okay, sudden changes of your breast skin, and etc. before the examination. Okay, do also inform the mammographer. This is very important, yeah. Okay, do inform your mammographer if you have had breast implant. Okay, breast implant inserted in your breast, not permit the X-ray to pass through. Okay, it will block the entire breast tissue. So in such case, we mammographer, we know how to modify our technique as a special technique can be used so that we can compress carefully and we get the image, the breast tissue image without rupturing your implant. Okay, so please inform your mammographer if you have implanted breasts. All right. And also the advice to practice calming technique, okay, as the nervous anticipation of the mammography imaging process can make your breath, your body really tense. Okay, so you can, I can advise you to try for breathing exercises. Try to bend your knees to release the tension before the examination. Then also you may listen to relaxing music before the procedure, the mammography procedure. All right, now we move to the don'ts tips. Okay, firstly, don't be afraid of mammography. Okay, remember we need the screening mammograms, so only 2 to 4 screening mammogram based on the American Cancer Society research findings. Okay, 2 to 4 screening mammograms in 1,000 cases. Okay, 1,000 cases lead to diagnosis of breast cancer. All right. Do not wear deodorant, okay, perfume, talcum powder, or anti-perspirant on your body on the examination, especially at the breast area part. Okay, so since all these products usually contain aluminium-based compound, okay, so when fell on our uh, image receptor, this contain substance can show up on our X-ray images. Okay, worse if the product mimic the appearance of some of the abnormality in the breast tissue. Okay, so avoid wearing this kind of products on the examination day. Don't consume high amount of salt and caffeinated drinks 1 to 2 weeks before the examination, as the salty foods increase your body's water retention, causing your body and breast to be bloated, okay, and become more susceptible to the discomfort during the compression process. Okay, consuming caffeine won't affect your mammogram result, but it can make your breast feel more tender. Okay, and lastly, do not forget to collect your mammogram report after the procedure. Okay, keep and file your report systematically, as the mammogram, the previous report of mammogram can be used as a baseline for future references. Okay, so as a conclusion of this webinar, I hope that you find the topic and you can follow those tips so that it can help you to prepare for your mammogram examination. Okay, as since based on the survival rate data get from the Cancer Research of Malaysia, all right. Compared to high income country, they can give the statistic of 9 of 10 breast cancer patients survive in past 10 years. Okay, but in our national average in Malaysia, for the same there's only 5 out of 10, 50% of the cancer survivors. Okay, the reason for this because of the poor outcomes in late detection and poor or delayed access to treatment. Okay, which all these things are potentially preventable, so we can increase the survival rate actually. So do your mammogram, as a mammogram can save lives, as they are the best way to screen for breast cancer at early stage. Okay, mammogram maybe not find every type of cancer, but the mammogram can find breast cancer appearance at a very early stage. Why we need the early stage detection? This can lead for early treatment option. Okay, wide range of treatment option and also it will give you better chances of survival rate. Okay. So here I'm sharing with all of the viewers the poster prepared by the Food and Drug Administration about the mammogram myths and things to know before you go for mammography procedure. Okay. So dear viewers, before I end this sharing session, the upcoming month, the October, also called as Pink October, okay, Pink October, which is the Breast Cancer Awareness Month. So normally in conjunction with this, most of the mammography facility, the diagnostic center, the hospital, may provide you a special event on mammography, a discount rate for mammography procedure, and other promotion during this period of time. So you can find out any promotion and event. So get your mammography done, ladies out there. Okay, with that, I thank you for joining the session with me, and I shall then pass the session back to our moderator, Miss Nadia. Thank you very much.
Okay, all right. Thank you, Miss Ainul, for the insightful presentation. So, dear viewers, if you have any question for our speaker, our lovely speaker, please leave a comment on the chat box. Okay, before that, maybe we have something to ask to Miss Ainul. Okay, just now, Miss Ainul, you said that the compression is a must. Basically, we can't escape the compression. So why is
Yeah,
it so
yeah, true.
important to compress?
As I said before, this is to provide high quality image of the mammogram where we need to bring as close as possible the breast tissue to the image receptor so we can increase the sharpness. Okay, we can lower the radiation dose as well. So we need to hold your breast during the examination so we can increase the sharpness, the resolution of the breast tissue image during our exposure time. Okay, so it cannot be avoid of the
Okay.
compression. Sorry to say.
All right. Okay, so let's look at the next question from Azalina Sudianti. So she is asking, can breast be sore after mammogram?
In some cases, thank you, Puan Dr. Azalina. In some cases, yes. So it can be a little bit sore after the examination, but it won't harm your breast at all. Okay, the breast tissue at all. Okay, so some physician, you may ask your advice from your physician. Maybe you can take a pain medication, painkiller or pain medication to ease the situation after the mammography procedure.
Okay, all right. So that's quite a lot of questions. So from Hanis MHS, okay. So how much radiation exposure received by patient for a mammography?
Okay, for a mammography procedure, it's between zero point 0.4 to zero point 0.5 millisievert, equivalent to 7 weeks of background radiation. Okay, so the risk of getting cancer due to radiation dose is really low for mammography procedure. Thank you, Ms. Hanis.
Okay, all right. One more from the next one is from Justina Bong. Is the patient with fat transfer augmentation suitable to do mammogram?
Sorry, I cannot get the question.
Is the patient with fat transfer augmentation
Mm-hmm.
suitable to do mammogram?
Okay. Yes. In some cases, we cannot get the the breast tissue, entire breast tissue. But we can manipulate. We can always manipulate our dedicated mammography machine so that we can get the entire breast tissue onto the image receptor. Then we can image your breast. Don't worry.
Okay, so the next one from Umi Maisa. What are the modification techniques available for other patients' condition or patient with disability?
Okay, thank you. As I said before, our machine can be manipulated during the process. Okay, some of the condition where the patient, kyphosis patient have abnormality of their spine curvature. Okay, so we can also manipulate our machine by having the compression plate invertedly. Okay, invertedly, so we can compress from the from down upward, so we can get the image of the breast in such cases. Okay, if patient cannot stand, let's say, patient cannot stand, so we can ask the patient to be sit down, and we can bring down our mammography machine so that we can still do the mammography examination. Okay.
Okay, all right. Thank you for the explanation. I guess we are running out of time. So those
Yeah,
are the questions
sure.
that we have this evening. So viewers, as mentioned in the beginning of this webinar, an e-certificate will be provided, and to be eligible for the certificate, you need to fill in the survey form, which can be found in the link in the comment section. So please do so. And before we conclude, I would like to give a heads up on our upcoming open day, which will be held on the 2nd and 3rd October 2021. It seems like we have another question. Okay, sorry. So there's another question. Okay,
Yes,
from
yes, sure.
Tachayani Thomas Peter. Sorry, I overlooked your question. What is the suitable age for a female to do this mammogram?
Okay, based on the guidelines, the suitable age to start performing screening a mammogram is 40 years old. But if you have any symptom, you can start immediately have your breast checkup. Okay.
Okay, there's no more, right? Okay, all right. So, viewers, please fill in the survey form so that you can get your e-certificates for attending today's webinar. So, before we conclude, I would like to give a heads up on our upcoming open day, which will be held on the Saturday and Sunday, 2nd and 3rd October. And with that, I conclude the today's session to our speaker. Thank you very much for joining us, especially and special thanks for the knowledge and experience sharing. To our
Thank you very
keen and
much.
attentive viewers, thank you for joining our webinar. We look forward to your comments and participation in our future events hosted by MAHSA University. For further queries, please contact us. Do contact us through the MAHSA website, www.mahsa.edu.my, or you can visit our Facebook. Okay, till then, have a pleasant day. Stay safe, everyone. Be safe. Assalamualaikum and bye bye.